Let's talk about menstruation. Menstruation, commonly known as menstrual period or a period, is a natural physiological process that occurs in females of reproductive age. It involves the regular shedding of the uterine lining and the discharge of blood and other fluids from the vagina. Menstruation is a normal part of the menstrual cycle, which prepares the body for potential pregnancy every month. Menstruation is the result of a complex hormonal interaction and serves as a key indicator of reproductive health. The process of menstruation is to provide a fresh, nourishing environment for a fertilized egg to implant and develop. If fertilization does not occur, the thickened uterine lining is shed and the menstrual cycle begins anew. Let's look at the phases of the menstrual cycle. It consists of the menstrual phase, which is the phase when menstruation occurs. The uterus sheds its lining and blood and tissue are discharged from the vagina. It usually lasts around 3 to 7 days. We have the follicular phase, and this is the phase that begins after menstruation and is characterized by the development of follicles in the ovary. One follicle matures and releases an egg during ovulation. Ovulation occurs around the middle of the menstrual cycle when the mature follicle ruptures, releasing an egg into the fallopian tube. This is the fertile period when pregnancy is most likely to occur. And then we have the luteal phase. After ovulation, the ruptured follicle transforms into the corpus luteum, which produces progesterone. The uterine lining thickens in preparation for potential implantation of a fertilized egg. And then finally we have the premenstrual phase. If fertilization and implantation does not occur, hormone levels will reduce and the uterine lining begins to shed, leading to a start of a new menstrual cycle. The duration and frequency of menstruation can vary amongst individuals. In most cases, a menstrual period lasts typically around 3 to 7 days. Although shorter or longer duration are also considered normal. The menstrual cycle typically occurs every 21 to 35 days, although variations are common, especially during adolescence and the perimenopausal period. There are several concerns and issues associated with menstruation, and here are a few of them. There's a premenstrual syndrome. Here, many women experience physical and emotional symptoms in the days leading up to their period, and this includes bloating of the abdomen, breast tenderness, mood swings, and irritability. These symptoms are collectively known as PMS. Painful uterine contractions called menstrual cramps or dysmenorrhea can also occur during menstruation. They can range from mild discomfort to severe pain and may be accompanied by lower back pain. Clients can also experience irregular periods, and they are characterized by variations in cycle length, duration of menstrual bleeding, or the absence of menstruation. Several factors such as hormonal imbalances, stress, weight changes, certain medications, or medical conditions can contribute to irregular periods. And then there's the heavy menstrual bleeding. In this case, some women experience abnormally heavy menstrual bleeding, which are known as menorrhagia, and this can be accompanied by prolonged periods, passing of large blood clots or excessive blood loss. Heavy menstrual bleeding can also be caused by hormonal imbalances, uterine fibroids, adenomyosis, or certain medical conditions. Amenorrhea could also occur as a challenge during the menstrual phase, and it refers to the absence of menstrual periods. Primary amenorrhea occurs when menstruation has not started by the age of 16, while secondary amenorrhea occurs when menstruation stops for more than 3 months in a woman who has previously had regular periods. Amenorrhea can be caused by various factors, and they include pregnancy, hormonal imbalances, stress, excessive exercise, certain medical conditions, or certain medications. Proper menstrual hygiene practices, including the use of sanitary products such as pads, tampons, or menstrual cups, and regularly changing this are important for maintaining cleanliness and preventing infections during menstruation. As we begin to wrap up this segment, it's important we understand that menstruation is a normal physiological process that occurs in females of reproductive age. It plays a vital role in the reproductive system and provides valuable insights into the overall health of the woman. Hence, it's important for every woman to understand its definition, the phases, the cycles, and common concerns related to menstruation, as this is essential for women's health and well-being. It's important also to consult with a healthcare professional for personalized guidance and to address any concerns or questions specific to menstruation.